Hello and welcome everyone to the overview of the new benefits program through A2IM. We will conduct a Q&A session at the end, so please feel free to add your questions to the chat. About us. Healthy is a benefits platform with coverage from vetted sources designed to put you in charge of your benefits options. You can access the benefits store through your A2IM member portal or directly at A2IMBenefits.com. The site is just like any other online shopping experience. Once you've created an account, you can browse your options, add items to your cart, then check out when you're ready. You can also reach out to our support team before purchasing with any questions, from effective date to selecting the right coverage for you. Once you purchase coverage, you will receive a confirmation email with receipt. Our support team will also follow up to inform you on how to get your ID cards when available. So we do things a little differently here. There's no open enrollment. You can enroll at any time of the year. There's also no commitment. You can cancel or change your plans at any time. All enrollments, cancellations, and changes are effective on the first of the following month, as long as you enroll by the 25th. All benefits are paid with your credit or debit card. This is a change from the standard of payroll deductions that provides full transparency for our members and means your benefits are no longer tied to your employer. You can take your coverage with you should you have a change in employment. We have a dedicated customer support team, and once again, we do things a little differently. You can call anytime to speak to a real person, book a virtual appointment, or send a quick text with your questions. All of our support staff hold insurance licenses and are more than happy to discuss every aspect of the plans with you. Last but not least, you can pick and choose whichever plans you like. There are no requirements placed on members. If you currently have health insurance through a parent, spouse, or state exchange, but need dental or vision, you can enroll. So let's take a closer look at the plans available. We offer many options to ensure there is something for everyone. I know there are quite a few options here. So if there's anything you'd like explained in further detail, please feel free to let us know in the chat. Our health insurance plans fall into three categories. They all provide nationwide coverage through the largest PPO network in the country, and all include a subscription to RightWay, a health insurance ally who will assist in finding doctors, scheduling appointments, disputing medical bills, and cost transparency for procedures and appointments. MEC plans, offering the lowest cost coverage, are possibly best suited for young, healthy individuals who want to keep costs low while also knowing they can see a doctor without paying out of pocket. Our common sense health share plans utilize a health share to keep costs down while still offering coverage for more major medical conditions. And our Ease, Bronze, and Silver plans, designed to be comprehensive for all your medical coverage needs while still being affordable compared to similar plans through an employer or state health exchange. Our dental and vision plans are provided by the largest carriers in the US. Delta Dental offers 2 levels of coverage, one to cover your routine dental needs like cleanings and x-rays, and a higher tier plan to cover everything from cleanings to root canals. VSP Vision Coverage has a low-cost plan for under $15 a month that will cover your basic vision needs, such as exams, glasses, and frames. Life insurance and supplemental insurance are available through our third-party partners. We'll get into exactly how that works in a little bit when we look at the website. Pandela is a new take on life insurance. You can shop around through all the major carriers alongside a representative at Pandela to ensure you find the right coverage to fit your budget. This includes anything from low-cost term coverage to whole life insurance. Supplemental insurance is provided by Aflac, which you may have heard of before, to ensure you are financially stable, even when confronted with major medical conditions like stroke, heart attack, cancer, or an accident that leaves you unable to work. Even if you already have your core benefits, health, vision, or dental, there are still a number of available options to you to save on coverage through A2IM and Healthy. Whoop home, auto, condo, and renter insurance shops carriers for you to ensure you have the best coverage for the price. Pet insurance provides the peace of mind that should anything unexpected happen to your furry friends, you will not be burdened with an unmanageable vet bill. Our additional resources include programs for fitness, weight loss, and mindfulness, with classes, materials, and online communities. Identity protection and legal services programs will protect you from online fraud and provide legal assistance. An important program to note is our personal asset protection program, covering anything from electronics to instruments. Phones can be covered for less than the protection plans offered by most carriers and include coverage on additional devices and personal property. Let's take a quick look at the store before we get to your questions. All right, so here you can see the store as it will appear to you, whether you access it through your member portal or directly through the website. All the plans will be listed on the front page. You can see the Learn More tab here. So the prices listed here are for the individual per month. If you click Learn More, you can view the price variance here. So were you to add a spouse, children, or a spouse and children being member plus family, you can see the pricing there. As you scroll down, there are a number of additional details that you can view as far as what's covered, what your copays might be, and what your deductible would be. You can see there are also linked out PDF documents that will give you even more details. So your basic questions you might ask, and the sorts of things that you'd look to have covered and what the cost might be to you. So as we go back to the store here, these are some of the plans that we've already discussed. Here's your dental and vision. There is also Medicareful for assistance in selecting Medicare plans. Now, this might not be something for everyone, of course, but if you do happen to be over 65 years old or have a relative who needs assistance, this is here as a resource also. Now you can see here with our third-party vendors, this will link out to a separate website for you to get a quote. So you'll input your information and a representative with either Pendela or Aflac will give you assistance. Here we see our additional benefits. Now, as I mentioned, for our audience today, the personal item protection program might be particularly interesting. Of course, covers anything electronics to instruments. So we've got here the website that will link you out to. You do actually get 1 month off your first month. And you can see here it provides coverage for, of course, a phone and whichever items you choose to register. So that is the brief overview. We don't want to burden everyone too much with going too far into the weeds. So I think at this point, we can open it up to some questions. And please feel free, if you have any, to submit them in the chat. So a few of the questions that we get quite often, people will ask me, if I sign up for a plan today, when will it be effective? So today being October 18th, if you signed up for any of these plans listed, they would have an effective date of November 1st. And again, once you sign up, we will follow up with you directly to make sure that you understand exactly when it will start, how much it will cost to you, and when you'll be able to get your ID cards. Oftentimes people will ask us, how do the health plans compare to the state exchange plans regarding price and coverage levels? Most of these plans are pretty comparable to anything that you'd find on the state healthcare exchange. I've had a few individuals I've worked with personally who were looking for coverage for pregnancy and childbirth that they could not find on their state exchange. And our Ease Silver plan was able to provide that for them. So I can say that we've certainly got something for everyone compared to the state exchange. As far as enrollment goes, you do not need to enroll for a full year. So you can enroll today, your benefits would start November 1st. And if in 3 months you change jobs and that employer offers benefits, you can reach out to us and cancel your plan. It will be canceled on the 1st of the following month. Okay, so what happens if I change jobs? So now all of these benefits, especially because they are direct pay, they're all what's called portable, meaning that they're not tied to your employer. So if you have a change in employment, you can maintain your existing coverage. And there's really, nothing that you need to do as far as letting us know or anything like that. Okay, what do I have to do to get enrolled? So in order to enroll, you'll create an account on the website. You can select the plans that you like and add them to your cart. And then once you hit proceed to checkout, you'll put in, of course, your additional billing information for the card that will be billed on the 1st of the month. And then here we have, are the health plans available in all states? So yes, they all utilize a national PPO network. So, even if you sign up with your current employer and move 3 states over and get a different job, you can still use your same benefits just as you would have. Now, are there any other questions or, okay. Let me pull these up here. Okay, so somebody asked, what's its relationship with A2IM membership status? So you are required to be a member of A2IM in order to participate. Now we are working with some individuals on an employer-sponsored plan that would allow them to cover artists that they work with also, but that's something we discuss in more detail on a one-on-one basis. Okay, can you explain medical deductibles or ceilings of coverage? Okay, so this will be a little bit specific to some of the plans. Now, if we're just going to pick here and say the bronze level Ease plan, a lot of this information is directly available, but we'll walk through it here so you're able to understand it. So these Ease plans have no deductible, meaning that you don't have to spend $5,000 before the insurance company starts to pay up or cover any of your costs. These plans do also have a max out of pocket. Now that of course varies by your plan level, but that would mean that that is the most amount of money that you would end up having to pay out. So with some of these, there's a $0 deductible and a $5,000 individual maximum. Meaning even if you have bills in excess of $100,000, the most you'd pay is $5,000. We have here, are there any gold or platinum health insurance options? Now, our silver plan is of course called silver. I will say quite honestly, if you were to compare this to what other carriers may call gold or platinum plans, certainly stacks up quite well. We try to make it so that everything's affordable and available for everyone. So these are the plans that best achieve that by balancing the cost and the coverage. Where can we view a list of participating PPO providers? That's actually a very good question that I should have mentioned to you already. For each plan that you might look at, as you scroll down the page, you'll see the link here, search provider network. So there you'll be able to input either a specialty and a geographic location or an individual doctor's name and search to confirm that they're within the network. Somebody, if I want to offer sponsorship to my musicians, what should I prepare before meeting with you? Now, there's not really anything that you'd need to bring to the table. We would just discuss the specifics of your case and the extent to which you wanted to provide coverage for the musicians you're working with. Okay, now, do we have any other questions here? Okay, I see another one. What are major differences between MEC and health share programs? So let's go back here and we'll look at this together. So then if you're doing it on your own, at least you've seen it before. So the MEC plans provide coverage for things like your routine doctor's visits, preventative coverage, and of course, virtual health and telemedicine. Now, they do not include coverage for what would be considered like major medical items if you're hospitalized or something serious to that extent. So that's where the common sense health share plans come in. Essentially, they have a health share on top of the MEC plan that for whatever would happen to you, as far as, a major diagnosis, being in a car accident and rushed to the ER, all of those sorts of things would be covered by the common sense plans, whereas they wouldn't be under the MEC plans. And we'll just give it a minute. If anybody else has any other questions, I'm happy to answer them. Okay. We've got a few. Good. What is the IUA under common sense? That is a great question. So that is essentially your deductible on these plans. That's the amount that you would pay out of pocket before the health insurance provider here would start to cover your costs. As far as questions regarding adding on artists or anything else that you have, you can scroll down to the bottom here and you'll see a form where you can input your information, how you'd like us to follow up with you. And we will either give you a call, send you a text, or an email. We can set a time to meet also. I see you've got another one. Can you have secondary insurance along with this insurance? Yes, there's no real restrictions here as far as what outside of this program you'd be able to enroll in. So as I said earlier, if you currently have health insurance through a different provider and would like to add to that, like to add vision or dental or any of the other programs here, you're more than welcome to do so. All right. Is there any other question? Remember, you can always, when you visit the website, come on down here and just add your questions in here. You can send a text to this phone number listed here, or just give us a call directly. We'd always be more than happy to answer any questions you have. I have people call and say, this is my current, health insurance plan. Should I switch? And that's something that we are happy to help with. Another question here, is everything a la carte? Yes, so there is nothing required as far as a package or anything that you need to sign up for that you don't want to sign up for. If all you need is dental coverage, you're certainly able to go in and sign up for that. If a month later, after you bought dental coverage, you decided that you actually do need health insurance, then you can go ahead and add that also. If 2 months later, you decide that you want to up your dental coverage to the higher tier plan, we can go ahead and make that change for you. And it would just be effective on the 1st of the following month. All right, we'll give 1 more minute for any additional questions. We certainly appreciate everyone attending today. Just so you know, this is recorded and you will all be provided with a copy. And if you do have any questions, like I've said, come down here and fill out the form and feel free to reach out to us.